Dr. Annette Teijeiro, and I'm running for Congressional District 1. I'm going to share a personal story with you, and I hope I don't break up a little bit as I do it, because I've always been a patient advocate. But just recently, my brother got diagnosed with lymphoma. And I'm saying that he just had his chemo this last Friday. My mother right now is too frail for us to tell her. But here's the experience. It's hard for me. When he had his problems, he went to his doctor like he's supposed to. He had a little bit of VIP treatment because obviously people know me in the community. But honestly, he was admitted to Sunrise Hospital on an expedited basis to have his biopsy for his diagnosis. But the fragmented care that's created right now for all of us dictated that he would be admitted through the emergency room. His primary care doctor would not be the one that would be admitting him. A hospitalist would be admitting him, who's contracted and employed by the hospital, who then admitted him, barely saw him for just a few minutes, placed him up on the floor so that he could supposedly have his surgical biopsy. Well, that hospitalist is told in no uncertain terms, you have to refer to the person that is in the hospital on call. And that person, that general surgeon, didn't come up to see my brother. He didn't come up that whole day. I, of course, went and talked to the nurses in the operating room. He was stuck doing emergency surgery. And he said, you know what? Tell her that I understand that she needs to have her brother's procedure done. If she wants to have anybody else do it, please do it. The following morning, still no procedure. So as a doctor, because I know a lot of people, I called up someone who's very near and dear to me that actually takes care of cancer patients, because that's what we needed to rule out. She told me, I'll be right there. And then she called me back and she said, I'm sorry, Annette, it's Easter weekend, and the pathologist that reads this is not available. And frankly, I don't want to make your brother go through a surgical procedure so that then we have to do it again if the wrong pathologist reads this. So we canceled it. He came out of the hospital. That following Tuesday, he was scheduled and done on his procedure. It was a very hard day for me. When she came into the room, I knew that he had cancer. The good part about it is, I also knew the oncologist. We were able to get him in right away. He was diagnosed, had his bone marrow, and like I told you, this past Friday, he had chemotherapy. That's the way medicine should be for all of you. He shouldn't have to have a big sister that walks him through that process. No one deserves a delay. But yet the system that we live in now, through years and decades of brokenness, I was just speaking to this lovely lady over here about mental health, and she attested to me the same thing that I know. People are not getting the services that they need. In fact, it's worse and it's more expensive.